Intussusception occurs when you are trying to wean off the child from breastfeeding, right? Or when you start introducing other feeds, because it causes the lead there is usually the enlarged Peyer's patches, which is like the lymph nodes around the intestine, and they catch on it, and then it forms the intussusceptum and the intussuscipiens, right? So usually when you are introducing other feeds to the children. Now, I have a question before we even move on. This is away from children. If you have a 70-year-old male who presents with symptoms similar to intussusception, what comes into your mind? What is the possible cause of that intussusception? Cancer. But it could be a lead. Always when you're thinking about intussusception, think about a lead, and it could be like a colon cancer, like a colon tumor, which is leading to that, which is leading as a point, the lead point. Because remember, intussusception is like this, like the intestine is like that, right? And then one involves into the other. So most of the time, the lead is the tumor in the wall of the colon, and then as the colon moves up and down during peristaltic movement, and then it rolls on each other, and then it gets into it. That's what the problem comes in, right? So when you see intussusception in an elderly man, think about possible tumor. It could be a benign tumor, but in an elderly man who is probably more than 70 years, chances are that something bad is going on, right? So I just wanted to throw that in. So what is the correct answer? The correct answer is volvulus. Volvulus presents with bilous vomiting, like we said, abdominal distension and dehydration. Remember that pyloric stenosis would also present with dehydration, failure to thrive, vomiting after meals. But volvulus is more acute. Pyloric stenosis would have gone on for some time. Volvulus, that kid will be sick because the intestine is turning on itself. That kid may even be in metabolic acidosis, right? Intussusception typically presents with intermittent crying, but bloody stools are more characteristic, and colic is unlikely with vomiting, abdominal distension. So I have another question, because we talked about milk protein allergy, and we also said that will also present with bloody stool. So who can differentiate between intussusception and milk protein allergy, for which both of them may have some bloody stool? But how will you tell the difference? Can someone help me? Okay, milk protein allergy. And what condition do we say children with milk protein allergy have associations with? Eczema.